to Vegas Circle Podcast with your hosts, Paki and Chris. We are people who are passionate about business, success, and culture, and this is our platform to showcase the people in our city who make it happen. On today's podcast, we're going to be jumping in to the importance of oral health and the behind the scenes of dentistry, and also what it takes to run a successful practice. Welcoming our guest to the circle, owner of Stunning Smiles of Las Vegas. We got Dr. Richard Racanelli, man. So my doctor, actually. So put him out there.
Thank you, Paki. Thank you, Chris. Happy to be here.
Yeah, man. So we want to just kind of jump right in, man. I know you're originally from the East Coast, New York City area. I've been a patient of yours since I've been in Vegas, but really have enjoyed your service and really just how you ran your business and customer service and the infrastructure of everything you've been able to do. But what inspired you to jump into dentistry?
Oh, man, dentistry. I decided when I was in high school, actually.
Okay.
I got influenced by my orthodontist when I was in braces. I kind of wanted to be an architect when I was a kid, but then I got influenced in science and medicine, and going through the transformation of braces really influenced me.
Gotcha.
And that's kind of how I got the bug and decided from there.
Good stuff.
Kind of a hard thing, you started going into there, and it seems like a pretty intrusive process. To think that experience was good enough to make you want to go and do it was impressive.
Yeah, exactly. My orthodontist was, I would consider him a mentor for sure, and he influenced me tremendously.
Good stuff. In New York?
In New York, yeah.
Okay.
Yes, sir.
So then you actually bought into a practice, right?
So really funny. I mean, you were in the practice before me.
Yes.
So 2024 is actually my 12th year in the practice. Took over in January of 13 and got to inherit some amazing patients like you guys.
Yes, I remember
was awesome. Bought it from the previous owner and have taken it and molded it and grown it in more what I wanted to kind of achieve over the years.
So, I mean, that's really what I wanted to talk about is like, Chris and I, we have, different people. We haven't had anybody on in the dentistry
That's
space.
super cool. Happy to be the first.
And what's interesting is like 8 to 5 or 9 to 5 or 9 to 6, you're a dentist, right? After, straight businessman.
100%.
I mean, there's so many hats you got to wear, from marketing, payroll. Chris, we talk a lot about like SOPs, the standard operating procedures that you have to put together. There's so many things behind the scenes that people don't know, that a dentist has to do of wearing that hat. Can you kind of share, some of the things that you kind of put to place and what you have to experience, kind of behind the 8 to 5,
Absolutely.
setup? So.
It's so true. You definitely wear a lot of different hats as a dentist.
Yeah.
You're a healthcare provider, but also a small business owner and doing all the different things. But as far as the practice, I've really focused on, elevating the quality of the care and customizing it and really trying to give people a way to get healthy as opposed to just put out fires and fix problems. That's what we've really focused on and brought in more comprehensive stuff, more cosmetic dentistry, things that people want, and hopefully evolving as health gets better, especially since the last couple of years.
Do you think buying into that practice helps alleviate some of that burden, since you kind of already had that pre-established customer base? You already have some of the implemented procedures in place for the business operating part of it. Do you think that really played a big factor in it?
Definitely. I mean, there's a learn on the fly component when you're young, come out of school regardless, but having something stable in place was huge. I actually started from scratch in New York, and I didn't want to do it again.
Yeah,
for sure.
Yeah. So this is your second time. This is my second time. A practice.
Yeah.
Yes.
Yeah. What do you see has been like the difference? It's got to be night and day different
in terms of
starting. Yeah, from New York City compared to Las Vegas.
Super different in a good way. I love it. It's been amazing.
Yeah.
I think in general, patients have gotten more focused on being healthy, but we really have a great desire to look good here too, which is nice.
Yes.
So those things go hand in hand.
For sure.
And a lot of our patients are really into that, and I'm luckily able to evolve my skills and be able to provide some really high-level service for that.
That's good stuff, yeah. And you've expanded. I mean, redevelopment, you've done a lot.
Yes, sir. You've seen it
in your
firsthand.
practice. Yeah, it's amazing, yeah. So what's your square footage like now in the space?
2,800 square feet.
Okay.
We have 7 treatment rooms.
Yeah.
And so myself, and another dentist now, and I'm focused on larger, comprehensive, reconstructive type dentistry. She does more general dentistry.
Okay.
And you've seen it. I mean, we're intentional about looking different, feeling different, smelling different, not being what maybe we think about a dental practice from when we were kids.
Yeah.
We need to evolve, and that's what I've been really focused on.
You could tell when you first walk in, I mean, it's very state-of-the-art, very modern. I mean, it's very, very, very sharp. I'm not just saying that just because you're here, but it's very sharp.
Thanks for that. Really appreciate it.
And as you kind of do develop and expand, right, it seems like the one thing I always try to understand better about dentistry is that, or even being a doctor for that example, is or a medical doctor, is a little bit your ability to grow is kind of limited, right? Because you can only handle so many patients. You only have so much time to be able to do it. How do you kind of foresee that growth and development in that part of it?
It's a good problem to have.
Yeah, yes. Very true.
Yeah,
does people hit that frequently, or is it always, kind of a revolving door of patients?
It's a great question. You want to really try to retain as many of the core patients as possible while bringing in new people for whatever services you're providing. And so it's definitely a balance.
I want to kind of change a little bit about like health, right?
Okay.
So like heart disease, obviously, is like one of the number one leading causes of deaths, obviously, in the U.S. But, you know, I was doing some research, and obviously, you know, with the, you know, the piece of oral, it's all related, right? Because this is everything. Everything comes through the mouth. Can you kind of share your perspective of, you know, maybe the preventative side of it, of you got to keep this clean because of the bacteria?
Yeah.
I mean, there's so many layers to it. I mean, I know you know it better than I do, but can you kind of share your perspective on that?
Absolutely.
Yeah.
Great question. Bottom line, healthy mouth is a step toward a healthy body.
Yep.
Oral systemic link is a real thing. Periodontal disease or gum disease is the leading cause of tooth loss. Somewhere between a half to 2/3 of Americans have some form of periodontal disease, and most people don't really have any idea. And there's massive links to systemic health, namely, like you said, heart problems and diabetes. Basically, inflammatory disease related to, the way I look at it is like risk factors. So like if you have gum disease and you have heart disease and you have diabetes, those link together. 1 and 1 and 1 is like 9. So it's not to say that if you clean your teeth, you're going to have any medical problems, but it's a way to reduce risk over time. So people need to be really, really focused, which I think in general has gotten better since COVID. People are more focused on health, but the mouth's a massive part of it.
Yeah.
It really, really is.
I'm always telling my kids, because everybody's always putting their hand in the mouth and doing all
Seriously,
type of
yeah.
stuff, and you don't realize,
Yes.
I mean, your hands are dirty all the time, you know, so it's really scary to be able to think about how bacteria can form so fast. So,
Yeah, one of the things we started doing, actually implementing right now, is testing patients' saliva to figure out the profile of the bacteria and gives an idea of risk for gum disease and actually how to treat it beyond the ways that we were taught conventionally. So it's something that's pretty cool.
Yeah.
Bring it into the practice as we speak, actually.
Okay.
Yeah, because it seems like most people that I talk to have very similar like regimens when it comes to mouth care, right?
Yes.
And the same things I did when I was a kid, I'm doing now at almost 40.
Same, exactly.
So you don't really change. Like most people haven't changed in 20, 30, 40 years on how they maintain their mouth.
You're right, and it should have changed a little bit.
Yeah, you would think.
I mean, an electric toothbrush, like a Sonicare,
Yep.
massive upgrade over the manual. That's like a non-negotiable as far as I'm concerned. Flossing at night, you know, coming in regularly. Like Paki's a great example. He's like clockwork with his hygiene. He comes in like I know you're going to be there every 6 months. And if we said, hey, you need an extra cleaning, you would likely do it as a way to get healthy. You also align your teeth, put them in the proper position, doing all the right
the
stuff.
Invisalign through your service. Yeah.
Like 10 years ago.
Yeah, for
and
sure.
you did an amazing job with it.
Yeah.
So there's little things that we can do and tweak over time to really keep things healthy. And my goal is for people to get healthy, stay healthy, and minimize time and energy and money in dental care.
One thing you're seeing too is a lot of people now are going with the veneers, right, and taking this out. Does that reset your clock in a way, or is it like how does?
Great question.
Yeah, how does that?
I do a
work?
lot of it, and I love doing it. It's like buying an expensive car. You got to maintain it. So just because you have veneers, you still need to do home care, come in regularly, see the hygienist, maybe even do an extra hygiene visit. And I really stress this when I'm planning this stuff for patients.
Yeah.
Yeah, but veneers are amazing, but you have to kind of maintain the investment.
Got it. Okay.
Is veneers considered implants?
Not at all. Something different.
It's completely
Yeah,
separate, right?
Absolutely.
Because I was reading about like implants. It's like literally, it's like I think 6% of Americans have implants or dealing with implants, and now it's like growing, I think, to like 23%
Probably
over the
rising.
next couple of years. Yes, unreal.
The percentage of people with missing teeth is crazy when you actually start thinking about it.
See, I was thinking because veneers you're still installing it in, but implants is completely separate. Okay.
So veneer, a thin shell of porcelain to change color, change shape, improve a bite, make a smile look different.
Got it.
Aesthetic and functional changes. Implant is a way to replace a missing tooth or missing teeth.
Completely.
Yeah.
God, I'm
Yeah.
sorry. Yeah, that's
So
the
no,
difference.
it's all good. I get that
Yeah.
question all the
Do
time.
you see people like just do 100% implants, or is it really only when you're missing one?
You want to be missing as little as possible,
Yeah.
right? Yeah.
Like
But there
someone
are
upgrade.
people who have nothing
Yeah.
and need to get full implants with
Oh,
kind
wow.
of dentures and bridges built on implants, and that's something that we can also do. The idea is to try to prevent that from happening in the first place.
Okay, good stuff.
Yeah.
I want to ask kind of like a personal question. I don't think I've ever asked you this too, just when I've been a patient of yours, but like the black toothpaste and all the stuff that you're seeing is popular. and-
Charcoal?
The charcoal, I'm sorry. Yeah.
It's a little abrasive.
What do you think? I mean, what's your perspective? Is that
I don't
healthy
normally recommend it, to be
Okay.
honest with you.
I
Oh,
figured
good to
you
know
would.
because I was using that for a while,
Yeah.
so I'm glad.
Because I wanted to,
Yeah.
I wanted to buy it. Literally, I was just telling my wife, I'm like, I'm gonna ask them tonight because I really want to buy that. Like,
Why?
for some-
What are you thinking about? Just
whitening? Yeah. I mean, I've been using other stuff. I just wanted to try something different because I've heard the good things about it, but I wasn't sure. So
Yes, it's one of that's definitely like a marketing thing that we see a lot out
that's
there.
what I figured.
Charcoal
Okay.
can really be abrasive. It can do some damage to the enamel.
Okay.
Way better off just doing some whitening either in your retainers or doing
Okay,
a whitening
like I've been doing,
treatment
okay.
and then maintaining it that way.
Okay.
I have a personal question too around
Sure.
the topic
Yeah,
because you
for sure.
normally there's the Colgates, right? And you have your more institutional toothpaste,
Yes.
and then you see now it's a big push for all of these organic, natural toothpaste. Is there any benefits to one or the other? 'Cause I'm all a natural, and even using the Colgates and stuff, it just doesn't feel great anymore since I've been using the natural for so long.
Got it. Great question. I'm not a fan of Colgate. I feel like it's got a weird taste
Yeah,
personally.
same.
I like Crest better. Arm & Hammer's good too.
Yeah.
Tom's, like people who are, leery about fluoride. Fluoride kind of gets a bad rap, but it really is good. It's a good vitamin for the teeth. If you ingested it, it wouldn't be good. And people worry about like third eye stuff with fluoride. You can't hear a lot
real.
about
Yeah.
that.
Yep.
But in general, if you're at all prone to cavities, fluoride is a really good thing to have in your regimen.
I use Burt's Bees. Is that any good?
Burt's Bees is super good.
Okay, good.
Yeah.
I'm messed up. I really wanted to try this charcoal, but I'm glad you said
I think
that.
the question, people ask about toothpaste all the time. The more important thing is floss at night, brush twice a day, see the hygienist 2 to 3 times a year, put all that together consistently over time. It doesn't really matter what kind of toothpaste you use as much.
Yeah.
That's honestly my answer.
That's the key. I think to everything is just consistency, right? Like, I mean, we were talking earlier, before Mr. Cartwright had left out, but it's like, Chris and I started this and my wife back in 2018, right?
amazing.
And consistency, I think, has been the savior, I think, to anything. Your practice, I mean, working out,
100%.
I mean, everything that we do is just consistency. So, yeah, I mean, it makes sense to have the health, your consistency.
Yeah, do the right stuff over time.
Yeah.
Do it regularly.
Let's talk a little bit about insurance, right?
Oh, man.
So I know insurance has got to be tough,
Yes.
right? What do you guys have in place? Because I feel like, I mean, I don't know the ins and outs of it, but like accounts payable obviously got to be a pain in the butt. You're filing claims. You might have insurance companies where they get the claim, okay, I didn't receive it or whatever the scenario is. But what have you guys kind of put in place so you're not chasing your tail a lot to be able to get paid for, the service and things along those lines?
Yeah.
Or is it getting easier, I guess
It's
is what I should
definitely
say.
not getting easier.
Okay,
insurance
that's the main
companies
question I wanted to ask, yeah.
are making it harder and harder over
Yeah,
time.
I've heard that too.
Sure.
People often think that dental insurance and medical insurance are the same thing, and they're really not. It's two
Completely
totally
separate,
different
right?
ball
Yeah,
games.
that's what I heard, yeah.
Dental insurance is like a coupon, basically, right? It's just a reduced rate that you pay. The insurance companies basically want to take in premiums and just not pay out. So they'll deny stuff. They make you wait. We have to jump through a lot of hoops
I bet.
to try to have accounts receivable and payable kind of happening.
Sure.
So it's just part of the name of the game. More importantly, it's that we don't let the insurance dictate the type of treatment that we plan and provide for our patients.
Yep.
We use it as like an adjunct. So we take it, we work with it. We try not to be beholden to, 2 cleanings a year. If someone needs periodontal treatment and need more than 2 cleanings, like they're going to get it. And we find a way to make it happen for them because,
That's awesome.
if we can see patients regularly, we can keep them healthy and actually minimize time and money in the dental chair over time. And that's kind of my goal, get our patients healthy.
Yeah. That makes sense, yeah.
and what
Health
kinda-
as well, for sure, yeah.
Yeah, and what kind of issues are you seeing? Like, I've seen a lot of dentists only accept certain insurances, certain types of insurances. What is the reasoning behind that? Like, usually that you see that when it come up.
Numbers game, they make it really hard. You have to do so much volume when you take all kinds of insurances to actually make money to run the business, and quality of care gets lost in the shuffle. So we're the total opposite. We're more time with our patients, customized care, and really being able to spend the time to give them what they need. And insurance doesn't always pay for that, unfortunately.
So you'll find like insurance that are willing to work with you, or that they're looking out for your client, and you partner up with them instead of accepting somebody maybe paying a really limited amount that's going to reduce services.
Exactly. I mean, I want to be their partner, but we work with them.
Got it.
I think we're the patient's partner, and then the insurance company is the third party. A lot of times the patients think that the insurance company is their friend, and it's the total opposite. They just want to make money. I mean, if you look at what dental insurance companies CEOs make, $12, $15 million a year. I mean, it's crazy what these guys are getting paid. Like, what are they actually doing?
Yeah.
Man,
Yeah.
I'm in the wrong business.
Yeah, man, seriously. It's
12 to 15
Yeah, you can
million?
Google it. You can look it up.
Oh, my God.
Yeah.
Yeah, we got to get
I
into
mean,
diligence.
this is a quote I say all the time. Like, they want to just take in the premiums and try not to pay out. That's their model.
That's
so we're
amazing.
fighting it every day to help people. And it's like it's a perception thing. And it's also compared to medical insurance where the expectation is everything's covered. I just pay my copay and that's it. With dental, it's different.
So let me ask you this. So, like, turnaround time, is it like 90 days? Is it like 120 days? It can get rough.
It
you
can
know what
be.
I mean? To
We
be
try
able
to
to float.
minimize it.
Yeah.
Yeah.
Good stuff.
Yes.
Okay.
Is there any alternative business models that you're seeing become more prevalent amongst other, dentists that are, subscription-based models, other type of opportunities?
Yeah, I mean, I think we have a membership plan for patients who don't have benefits. So as
Got
an
it.
alternative,
Yes,
they can subscribe to us, and we have
We had a couple
fixed
doctors on
pricing.
when we were talking about that.
So
Yeah.
that's been a great thing, a good like alternative. And in general, just really educating patients on what it costs to actually do what they need to do and be healthy long term.
For sure.
Yeah.
Yeah. What do you see what happened with technology? Because you're always
man.
having the newest stuff. I
Yes.
know you're always at seminars and things
Yes.
like that. I know it's got to be expensive too to invest in a lot of this technology. But what are you seeing, and what have you kind of special at Stunning Smiles that maybe another practice doesn't have?
Yeah, technology and dentistry going hand in hand at this point. We have a lot of interesting stuff.
Yeah.
Lasers to treat periodontal disease. In-office machine, it's called CAD-CAM, basically a way to make metal-free crowns or bridges in the office one visit, which used to be an impression in a lab and a second visit, and getting numb again, doing all this stuff. Now we can do it in one visit using the technology. So I can design and make stuff in the office, which has been an awesome game changer. Probably about last 10 years for that.
Wow.
CT scans like cone beam, which is basically a 3D X-ray to plan for implants, look at sinuses, wisdom teeth, stuff like that. Digital X-rays, we've always had those, but that's one of the first things that came out with technology.
Sure.
And then also scanning. So a lot of the stuff that we used to take impressions for, we actually use 3D scans now. So there's no goop.
That's how you guys do.
Everybody hates the
Yeah.
word goop, right?
Yeah.
So we've eliminated that, and it's going even more so with AI too.
That's amazing.
Yeah, being able to help diagnose and look at the X-rays with the help of AI. That's something that's coming along.
Yeah.
Too.
Yeah,
So-
like I could say that from experience. Like you'll be sitting in the chair and they're talking to the AI and it's recording everything
Oh, wow,
while
that's
you're in
cool.
the chair. It's the coolest thing in the world. You guys have got that, and it's amazing.
I mean, the technology it's not a substitute for care and relationships
Sure.
and rapport, but it really does help us be more efficient and I think deliver better product, better service for our patients.
Yeah, that's no joke.
That's interesting.
Just backing up a little bit, just
Yes.
more about personal question too. Dental floss versus water picking, right?
I was going to bring that one up.
Okay,
yeah.
good. Yeah, you're the
I
same
get asked
line. We
that all the
aligned
time.
right now. That's my brother,
Yeah.
so we aligned.
That's hilarious.
So like, I'd have a water pick.
Yes.
Are you still supposed to, floss afterwards, or what? Like,
No, I mean if you
are you
can-
overdoing it? Basically, is what I'm getting at.
no harm to overdoing it, but if
Okay.
you can actually floss every night, you're good. Like that's what I do personally.
Okay,
I don't use a water
that's
pick.
what I'm getting at. I want to know what you're doing. Yeah. Okay.
Water pick, I recommend it all the time, and I
Sure.
think it's kind of like plan B if someone's like, you know what, I'm not going to floss consistently. I have trouble doing it. I don't love doing it. Then I'm like, get out the water pick and flush because
Sure.
you can't get in between the teeth with the toothbrush. That's the idea, right? You need something to go in there, get the plaque out, so you don't get cavities, so your gums don't get inflamed.
Got it.
Bottom line.
Got it.
So it's better than doing nothing.
It's
So
way
right
better than
now-
doing
yeah.
nothing, for sure. And if you have a lot of dentistry, like crowns or bridges, sometimes the water pick is a really good thing to have in the regimen also, for sure.
Sure. Yeah.
Yeah.
Awesome, man.
Yeah.
Good to know.
You know, with us being parents, right? All
Yes.
of us parents at the table, internships were big for me, right? Back in the day, like I think we talked about it before. I did an internship at Tufts Medical for a while, and it was a great experience just to kind of learn the medical side of everything, and then also realizing, okay, this maybe not be for me, right? What do you think like the future of dentistry, for kids, right? Is it maybe going the internship route? Maybe can they go work at a Stunning Smiles, or do they have to go to UNLV and maybe
Yes.
learn a program before they get to
Great
college to
question.
expend the capital?
Anybody who's interested in any field, for that matter, but it's dentistry specifically, the sooner you get some exposure, the better off you are. So if you could do an internship, a volunteer in an office, I think it's a great plan.
Yeah.
I actually didn't do anything like that. I just kind of rolled the dice and went with it. And luckily
Sure.
it worked out.
Sure.
So I had no experience being in an office other than being a patient until I got into dental school.
Yeah.
But I would really recommend someone in high school or early college to, ask their dentist, like, hey, can I come shadow? Can I come observe? I want to see what it's like in the real world and know if it's worth, going down this road because it's a commitment.
It makes a lot of sense. Yeah, because that's schooling on top of
Yeah,
it, then
man,
building. Like
yes.
it takes a long time for you to really hit your rhythm.
Yes,
So it'd be tough if you figure it out 5 years into it.
Exactly.
What I remember when I was at Tufts Medical, when I was at high school, I would never forget this lady. I want to say her last name, but her first name was Alicia. And I remember her and her husband both were in medical school. Basically their last year owed like $300,000 back then, both of them. So they're like $600,000. And they hated what they were doing before I'm getting
man.
out. And I'm like, there's no way I would want to
brutal,
do
right?
That's extremely
That's
brutal.
tough.
Yes.
Yeah, extremely brutal.
Yeah. So earlier information, the better, suss it out, make sure it's for you because
Sure.
you have to love it to really, I think, to do well and make it a long career that you're happy in.
Yeah, sure. Yeah, I'm always talking with my kids about stuff, just trying to figure out their lane.
I mean, anything, right?
Yeah, 100%. So,
Yes.
with us being in the circle, right? I know you mentioned a little bit about, when you first got into your first practice in New York. So who's been in your circle and what advice have they given you, over the years that's been beneficial?
Oh man, that's a really good question.
Yep.
I recently expanded my circle a lot in Las Vegas. I got into a networking group called
Okay.
BNI.
Okay.
Business Network International. It's been awesome, and I've met a lot of interesting people who run different businesses. So that's been a really good expansion of people that I could talk to and learn about.
Yeah.
Prior to that, it was really just people in dentistry that I would network with and try to learn from, and emulate like what the people who were really at the top of the game were doing, so I could bring it into my practice.
Good stuff.
Yeah, very interesting. And you see it like, like it seems to me like there's a dental office in every corner, right?
There certainly
are. There's a ton of them. So it seems like there's a great network of dentists in the valley. But when it comes to like a competition standpoint, is there, obviously I don't think more people should go to the dentist if they're not, but do you think there's enough dentists for the population, or the population is
It's a great question. I don't have any stats. It seems like it's, like you said, it's very saturated, but the truth is there's a lot of levels. There's definitely a stratification of what's going on in dentistry. And you could go to like ABC Dental, that's like, volume, where you see a different doctor every time and you wait for 3 hours. Or you can come to my office where you're getting me with my expertise and my training, and I'm doing a reconstruction on someone that's like buying a car. So there's a massive
kind of scale.
gap and scale.
Yep.
And it really is based on what's, I guess, money, but also what people want. There's always going to be the cream rises to the top, so to speak. I agree. And there's always a lowest common denominator. And you see that, I think, in dentistry quite vividly.
Yeah, I think you're right. And I think I never thought about it in that way, but you could definitely see it. And is it like there's like a significant number of the population that just doesn't go to the dentist? Like 30%, 40, 50?
I should have looked up that. I don't know
I'm
the
curious,
stat, but yes. The answer is yes.
Jeez,
and it should be a lot lower. Like, people should go.
Yeah. Yeah, for business advice, right? Because you're a business owner, right? With running your setup. What's a nugget that you would share for somebody? Maybe they want to start their own, dentistry practice, or maybe they have another vision, of something that they, want to launch. What would you share with them, or what would be some advice for them that's been a benefit for you?
Besides your field of specificity, whether it's medicine or dentistry, learn as much as possible about business, marketing, management, people skills, communication.
I agree.
Dentistry is really a people business more than a tooth business.
And
being able to just like build rapport and understand and ask questions and have like really good conversations has, I think, helped me do well in dentistry more so than my hands, which are also really good. But it's really about, can you talk to someone? Can you interview them? Can you find out what they want, what's important to them in any business, not just dentistry?
Yeah. And I gotta tell you that just from my own experience, you've done an excellent job with that. I gotta tell you to your face that that you've done that, to have the bedside manners and be able to be professional and be able to build those relationships. You guys have done an excellent job.
Thanks
there.
a lot, Paki.
You and your wife,
means a lot.
over there.
It really does.
Good stuff. Got to switch a little bit because I know we see each other at restaurants all the time.
Oh, yeah,
too, big
absolutely.
foodies, so
one of my favorite things.
Yeah, gave me some recommendations, but we always ask our guests, what's your favorite, or you and your wife's favorite restaurant? Give us a gem of where you like to eat at.
I love going out to eat. It's one of my things that I enjoy the most.
Yeah.
Italian and sushi are kind of and some Thai also.
Yep.
Just discovered a really great sushi place called Kase Sushi and Sake.
Okay.
On Russell and Jones.
Okay.
I'm going there. It's awesome.
Okay. Good. Note that. Okay. Good
For
stuff.
Italian, Ferraro's.
Ferraro's is great.
They're friends of mine. We love them.
Yeah.
They're awesome.
Ferraro's is very good.
Go there a lot. And Amari, actually, in Uncommons. I like that place a lot. It's like
Amari's very good. Yeah. Italian restaurant.
Italian place, exactly.
Yep.
Like,
good stuff.
Become like a neighborhood place in the Uncommons.
Yeah.
Go there a lot also.
Awesome. Yeah, you gave three great ones.
And then one more. Sette Bello.
Which one?
Sette Bello for pizza.
Oh, Sette Bello. Yeah. Okay.
I'm there all the time.
Oh, we're aligned. Yeah, we're definitely aligned. Okay.
I'm always looking for good pizza, so definitely check that
definitely
out.
check
And he knows we're from New York, man.
Man.
That's a hot button for you guys.
But we're lucky. We have a lot of great places.
Yeah,
we really do.
We really do. It's amazing.
That's the one thing, we talk about all the time, man, is like, I've been here for 17 years and moved from, originally from the Midwest, but I lived in the East Coast.
Yes,
but
I remember.
I tell you, like, Vegas is really becoming this hub of, food, art. I'll share some stuff offline that we can talk about, but they're doing some amazing things, enhancements.
It's amazing how it's changed the last, think about the last 5-7 years.
For sure.
Just look at where my office is.
100%.
With the Ben, Uncommons, IKEA, Lifetime going up. Just what's going on in that immediate area of the Southwest.
They've said
it's
that
awesome.
that loop is like probably the most popular area in Vegas as far as real estate and land in that whole area.
Oh, yeah. Everything that's been a big impact of Vegas construction has really taken place in that area.
Exactly.
Yeah. So, awesome, man. You did a smart job with real estate, try to pick the right office. So that was a home run.
Sometimes it's just luck.
Yeah, home run for sure. Anything we forgot to ask that you want to leave us out on?
I don't know. I'm really enjoyed having the conversation. It's been awesome.
Appreciate it, man.
Yeah, I'm really happy you guys had me on.
Yeah,
Definitely appreciate having you on.
What's the social handles people can reach out to you guys on?
So my Instagram is at Dr. Rack Vegas.
Okay,
and
awesome.
The office is lvstunningsmiles.com.
Right, appreciate it. This guy's great. I'm just gonna tell you that straight up, man.
Thanks,
great, had great practice. They do it right. That's why I wanted to have you come on, and appreciate hanging out with us and check us out at thevegascircuit.com. So appreciate your time, man.
Yes,
Thank you
sir.
so much.
That
I
was great.
appreciate it.
Great to see you.
Thank
Really
you.
good.